My name is Tom Kresham, the Director of Graduate Admissions. I really appreciate everybody joining us tonight for the IONM virtual information session. It should be a great event, and I appreciate everybody taking time out of their busy schedule to join us for this. I think this is certainly a worthwhile opportunity for you to learn more about the IONM program, which I think, as you will come to find out from the presentation, this is a unique program. There are very few of these across the country, and there is a huge demand for this profession as well. So this is a good time to be looking at a program like this. But before we go any further, if the rest of our team wouldn't mind introducing themselves so the group can get to know us. So whether you're watching live or you're watching the recording, this is kind of the IONM team, basically minus myself here, that will be teaching your classes. We can start with Dr. Zaleski.
Hi, I'm Dr. Tom Zaleski. I am the graduate coordinator for the Doctor of Audiology program. It meshes with the IOM program, and I just want to welcome everyone for coming in and listening to the presentation. And we've got some great people. So I, like Tom, don't per se teach the IOM courses, but I'm involved with the Au.D program.
Great. Thank you, Dr. Zaleski. Dr. Hale.
Yeah, hi, I'm Dr. Tyson Hale. I'm an audiologist. I am the coordinator of IONM Geisinger Medical Center. Also help at Bloomsburg University. I'm director of the BU and Geisinger affiliation. And nice to see everybody, and hope I can answer some questions.
Great, thanks, Tyson. Dr. Knecht.
Hi, I'm Dr. Aaron Knecht. I'm an audiologist as well, like Tyson. A surgical neurophysiologist at Geisinger Health System. I've been there for about 11 years. I also graduated from Bloomsburg through the Au.D program, and I did concentration in surgical neurophysiology or intraoperative monitoring. So at the time, that was kind of before we had the standalone certificate program. I also kind of act as an adjunct faculty member for the IONM program. I do teach some didactic coursework, and I do a lot of the clinical training for the certificate program. So the students that come through the program spend a lot of time in the operating room with me.
Great, thank you. And Dr. Yu.
Hi, hi everybody, welcome. I'm Dr. Yu. I'm a faculty within the audiology department, but at the same time, I may help students who's on campus going through the paperwork and also teach some course. I just being resourceful to help you. Thank you.
Great, yes, thank you. And so we're going to jump into the presentation here. But if anybody has any questions, please feel free to ask. This can be, we will have an opportunity for Q&A after the presentation is done. But if there's a subject that you want to know more about as we're working our way through the slides, please feel free to get the question into the Q&A function. And again, then we'll be opening it up to Q&A after we're done as well to wrap up the event. So I will share my screen, and I will turn it over to Dr. Zaleski.
Okay, welcome everyone. As I said earlier, I'm Dr. Zaleski. I am the program coordinator for the Doctor of Audiology program. Bloomsburg is a unique setting for multiple reasons. We have a Doctor of Audiology program, as well as the intraoperative neurophysiological monitoring program. That is a whole separate program at the campus, which is a one-year program. And I'm not going to spend a whole lot of time on that because these other people will speak more about it than I will. And also is students in the IOM can take the additional courses. I'm sorry, students in the Au.D program can take the additional courses to get the additional certification to perform and meet the challenges, and also work as an interoperative monitoring specialist in addition to audiology. So that being said, I'll turn it over to the rest of the panel to present more of the information.
So could we just start with just a quick introduction to what the IONM field is, because for some people in the audience, this might be their first introduction to this. So if you were to explain this to someone who's entering a field like this, Dr. Hale, how would you kind of summarize the program?
So Well, what is IONM? If you're not already aware, it stands for intraoperative neurophysiologic monitoring. And as the definition on the screen says, involves a wide variety of electrophysiological methods to monitor the functional integrity of neural structures during surgery. Monitoring the state of the nervous system can prevent permanent neurological deficits and thus improving patient safety and surgical outcomes. So that's quite a mouthful, but basically, we are kind of like the patient's number one advocate in the operating room that's having any kind of neurologic surgeries. Could be an orthopedic surgery that involves the central nervous system. Could be a vascular surgery, like, for example, a carotid endarterectomy. And we can do various types of recordings to help monitor the nervous system. For example, we want to monitor the sensory pathway with a modality called somatosensory evoked potentials. We monitor the motor pathway, and those pathways can be at risk during various surgical procedures. An example of a common surgical procedure that we would monitor would be a spine surgery. And we might be getting into a little bit more of that as the slides go on, but that's kind of like a basic background of what we do. And so we get a baseline, we monitor during the surgical procedures, and then we kind of report the status to the surgeons in real time so they can take that data, and make possibly some functional changes during the surgery to positively affect surgical outcomes.
So, Dr. Hale, is it safe to say that, or maybe the simplest way to explain would be, this is a clinical professional who monitors brain activity during surgery? Is that accurate, or?
Yeah, that's partially accurate. We monitor brain activity.
Okay.
We can also monitor spinal cord activity, peripheral nerve activity in the form of, muscle responses and things like that.
Okay. Great.
So I can jump in just a little bit, explain this a little bit further. It just recent years people realize during the surgery, particularly for spine surgery, brain surgery, some other type of surgery, vascular surgery, and the ENT surgery, if you know that, it actually we are facing a great deal of risk of the patient injury during the surgery. The surgeon's goal is to try to help the patient. But for some reason, because the procedure too complicated the patient's medical condition, that the surgery itself could damage the patient's vital nerve. Actually become quite obvious that happens very, very often. And that's why the intraoperative neuromonitoring become a profession, because the goal is to avoid that from happening. That's one aspect of the IOM, which become very popular in recent years. Many physicians realize, surgeons particularly, realize the importance of the IOM that can safeguard the patient, and they use our service very, very often now. In addition to that, the IOM also provide a guide for more sophisticated surgery. For some type of surgery, surgeons may not able to perform that in the past because they couldn't visualize the structure, the issue underneath directly. However, with the guide of the intraoperative neuromonitoring, the surgeon knows very well what they are facing, what's under the structure underneath, and also realize the procedure, should they follow our guidance, actually could get a much better outcome than the surgery otherwise they performed in the past years. So this is we consider modern medicine and a future way of performing surgery of patient care. So just add a few sentences here.
No, that's very helpful.
You want to say a few sentences?
Yeah, no, that's okay. That's okay. That's very helpful. Yeah, and sorry, and Dr. Connect, if you had something to add, go ahead.
Yeah, no, I think they both hit that pretty well. I guess from a more practical standpoint about what we do, which I'm sure we'll get to, is we're kind of in the OR during the surgery, so we're part of the surgical team where we have direct patient care. So we're setting up the patient with all our monitoring equipment, testing equipment, And like Dr. Hale and Dr. You said, during that surgery, we're kind of continuously testing that patient's nervous system and nervous system function to monitor for any change that we see to indicate that the surgeon or maybe some other factor is contributing to some neurologic deficit in that patient. So we're really there as kind of a safety net for the patient. If we see changes in our data, we can work with the surgical team to correct those, and it's all about kind of positive patient outcomes. And like Dr. Yu said, we do some advanced surgeries where we're, for example, we're mapping a tumor, a brain tumor that's close to the areas of the brain that control your movement. So we can stimulate those areas of the brain, tell the surgeon precisely what parts of the brain control the arm, what parts of the brain control the leg, and that can guide the surgeon's resection of that tumor. So they stay away from those eloquent areas of the brain and they only resect the tumor. So some surgeries, we have a really interactive, really kind of advanced role for what we're doing.
Yeah, that's great. Yeah, to talk about, I mean, there's certainly a lot at stake, and it's easy to see the importance of a field like this. And Dr. Knecht, I know you had kind of gotten into this. In fact, you probably already provided an explanation for what does a neurophysiologist do. Anything to add, Dr. Zaleski, Dr. Hale, Dr. Yu?
If I had it for the audiology perspective, what I have heard from professionals out there, reason why they like audiologists, why this kind of falls under audiology, it deals with interpreting the results that you have, and neurophysiological results or testing has been within the field of or under the scope of practice of audiologists forever. And the nice thing, what I have heard from talking to people, they like our ability to critically think and be able to look at the results to make critical decisions for patient safety, as the other panel members had indicated.
Great, thank you. Thank you. So now I know, Dr. Knecht, you had mentioned that they are part of the, I guess they're in the operating room, or I should say you are in the operating room, you're part of the operating team. What's a typical work setting? Is it 100% surgically or surgically based, I guess? How would this compare with some of the other clinical positions, whether it's a doctor or a nurse practitioner or a PA? Any comp there to help provide a frame of reference?
Yeah, absolutely. So I would say that what we do is primarily surgical. We spend the good chunk of our day in the operating room with the patient. So we go to the hospital relatively early before procedures start. In the morning, we bring our equipment to the operating room. We set up all of our equipment, get all of our electrodes ready that we're going to place on the patient. Usually we'll go talk to the patient in pre-op before they come back to the OR, get consent, let them know, what we're doing, kind of get case history if we need to do that. And then the patient comes back to the OR. We're in there with the rest of the surgical team. They put that patient to sleep. Typically for our procedures, it's general anesthesia. And then after that, we kind of set up the patient. So we put all of our monitors on the patient, and we start doing our testing during the surgery, and we continue that testing throughout the whole procedure. And then after the procedure's over, when the patient's waking up, we're kind of taking all of our electrodes off, and then we repeat that process as many times as we need to during the day. Our surgeries, I would say, generally, since they're more complex surgeries that require our service, tend to be a little bit longer than something that you might be used to, maybe a 20-30 minute surgery. This isn't really like a tonsillectomy kind of procedure. This is spine surgery or brain surgery. So they can be anywhere from 2 to 4 to 6 to, Dr. Hale can probably vouch, we've had surgeries that have lasted 20 plus hours, depending on the complexity. So there's kind of a wide range of things that we do. But yeah, we're basically almost entirely in the operating rooms.
Yeah, that's super helpful. Yes, thank you. Thank you. So why the IONM certificate? Why would a prospective student, either for the audiology program or for the standalone certificate, basically, why would they want to go into this program?
Tyson, Dr. Hale, can you talk a little bit about the demands, and people are sort of really looking for our graduates and try to hire our graduates, right?
Yeah. So right now there's a really high demand for the surgical neurophysiologist, and in this particular profession. Our graduate certificate program is a 1-year program, and we kind of combine everything, um, involve your clinical rotations through Geisinger as well, and you're able to do all the didactic coursework through Bloomsburg. And so if this is something that it sounds like you'd want to do, and have this degree in about in 1 year, you could have it, and you could be in the OR monitoring cases within that year. So yeah.
Yeah, so far, in terms of the demands, our graduates are really, really doing well. And Dr. Hell has been working with them for employment. And so far, we have 100% of people get hired. And people just really like our graduates for the reason that many people right now doing IOM, they did not have the standard or the so-called professional university sponsored training. And we actually provide the students with this kind of opportunity along with a few other universities in the nation. And so the students actually can stand out, and if in the future you get hired by, for example, some hospitals in Florida, in West Coast, and everybody here that you train from Bloomsburg, they will take you very seriously, because you're going to go through a formal training program, guaranteed you gain the knowledge skills that is aligned with the expectation for the IOM practice.
Mm-hmm. Yeah, it seems like, as you look at the landscape of IONM, most of the IONM training that's delivered is offered by other hospital networks. Is that?
Yes, I can answer that a little bit. I'll go back the history of the IOM. It really start from audiologists, and who actually I can testify that audiology training is very much similar to IOM training, because I'm teaching both track, and I see the similarity in terms of the skill sets and the knowledge, and the emphasis in terms of the science. Mm-hmm. So that is and that is audiology is a major group that initiated the IOM. And there are also quite a few PhDs that from the neuroscience. They have the proper training, understanding of the nerve system. They also get into this business. And then we have the medical doctors. So these people start the IOM.
Yeah.
And at the time, they just randomly training some people who had some sort of qualification that they felt that can transition into the IOM practice. And it is only until recently, and we are one of the pioneer university start to offer this kind of training within the university curriculum. Mm-hmm. So we have a curriculum that take care of every required knowledge and skills required, sort of demanded by the profession. And so the student graduate will have a paper. And then when you show this paper, and the employer will consider you very seriously.
Great.
And also great for your future career progression.
You get a credential. You get a credential.
So basically, if in an organization, if they choose some leader, they're looking at somebody who had the formal education on this topic.
And I can speak just quickly to some of the history here at Bloomsburg, how we got started on this. Well, what had happened was I was in charge of the 4th year placements, and a student was interested in doing some IOM at the time, and trying to set up the site, talking to peoples at the company where the student was going to go. We got into a discussion of the need for professionals getting the appropriate training. And as Dr. Yu had said, a lot of times they didn't have the appropriate training. A lot of it was on the job. They would bring them in and give them short courses, and there was a huge need for interoperative monitoring specialists, and the person felt that actually was an audiologist at the time, and said, you know, your program is a good program. It would be a great program to mesh with it, to train these people who are in need, and we'd love to get things started with you guys. And that's how it kind of started. We meshed with this company and started working with them, and then developed the track, and here we are today.
Yeah, that's great. So now, Dr. Zaleski, is it safe to say then that IONM is a subspecialty of audiology?
Yes, it is. Yes,
Okay.
it is.
That's helpful to understand. Thank you. And sorry if you heard, I had my 4-year-old had kind of Zoom bombed us. I guess he had some thoughts on the IONM field, so I apologize if you could hear that in the background. But now we can kind of get into some of the details of the program and kind of the structure. And Dr. Yu, the gentleman in the photo there, looks pretty familiar. And Tyson and Aaron, nope, I don't see you in that photo. We'll have to get you scheduled for a photo shoot. But would you be able to walk us through the program?
Tyson, are you on, Dr. Hale? Are you want to talk a little bit about the program, or you want
Yep,
to
sure.
Okay.
Yep. So as the slide indicates, it's a total of 33 credits, and I had mentioned before it's a 1-year program. It's also offered as a part of the Doctorate of Audiology degree, which is a 4-year program. And so if those of you interested, students that are on here watching, if you're already interested in the audiology program and you wanted to kind of check this out too, it would be an additional 12 credits beyond, and I'm not sure how many credits total the audiology program is, 4 years worth, probably quite a bit, but this is offered in person and online. And then the online students would do the clinical rotations at their site of employment. Our program, and this last stat here, is one of few in the country offering IONM training. I believe we're one of 4. And Dr. Yu, correct me if I'm wrong.
4 or 5, yeah.
4 or 5, right? And maybe one of 3 that are accredited, or one of 4 that are accredited. So, and yeah, so going back, 1-year program. In the first year, we concentrate on the basics, and I mentioned before, you know, spine surgery is probably one of the main, one of the original indicators of intraoperative monitoring, and one of the main surgeries that we monitor. And so we teach a spine surgery course, and a couple other basic courses, and then we start getting you into the OR as well over at Geisinger. And during that first semester, whether we have a few different campuses, one in Danville, which is the Geisinger Medical Center. We have one in Wilkes-Barre, Geisinger Wyoming Valley, and then campus in Scranton, which is Geisinger Community Medical Center. And so you may, on your clinical day, go to either one of those campuses and monitor 1 or 2 surgeries with a senior neurophysiologist, which would be your supervising neurophysiologist for that day. And they would kind of walk you through everything you would need to do in the operating room as far as monitoring. And so usually by end of the second semester, you're running a little bit of the case. You're actually placing electrodes as soon as the first semester under our direction. And usually by the end of our program, I would say most of the candidates could probably monitor a simple case, all by themselves. And a lot of the cases that you gain experience with us, or our clinical externship sites, can work to go toward the certificate that you would attain that's outside of the certificate that Bloomsburg gives you. There's another certificate, which is the CNIM, the Certificate of Neurophysiologic Intraoperative Monitoring. which is required by many hospitals to do IONM. So we, you know, give you the experience you need to log cases there. I believe you need there's a 100 case requirement to sit down and take that CNIM test. And if anybody wants to add to what I'm saying right now.
Yeah, okay. Yeah, Dr. Connect, can you talk a little bit about the actual clinical training? Your student will come to you first semester, and what they do, what they learn, and what's the expectation? Can you talk a little bit?
Yeah, sure. So as Tyson said, you know, it's kind of a 3-semester program. You can kind of go on the Commonwealth website and you can look through the course sequence. But what you will notice if you take a look at that is every semester you have a clinical component to that. And that clinical component entails you coming to the operating room. If you're one of our students that are in person, you're going to spend at least some of the time at Geisinger with our neurophysiologist. If you're doing the whole program online, which is something that we're kind of new to, but you would be able to set up a site elsewhere that you'd be doing your clinicals. But the way that we structure the clinical program generally is the first few weeks of the first semester, I run the clinical program in the fall. So I kind of do a crash course to get you ready for the OR. Most of the people that we see in the OR, most students in the OR have had previous experience, that come from other specialties, nursing, PA, medicine. So they're all kind of used to how to get around the OR. If you've never been in the OR, it can be a little bit of an intimidating environment. There's kind of a whole different set of rules that we need to abide by there. So if you watch any of those fun shows on TV, Grey's Anatomy, or any of the new ones, the way that they behave in the OR is not really the way that we kind of act. So the beginning of the program is just kind of us learning how to behave properly in the OR, learning the things we can touch, what we can't touch, and so on. After we get through that for the first couple of weeks, we bring you into the OR. The way we structure the program really depends on the number of students we have in any given year at the program, but you'll get at least one clinical day per week throughout the semester. So you'll come into the operating room, depending on our schedule for that day. We'll set a time for you to be there, and you'll be one-on-one with one neurophysiologist for at least one surgery, sometimes multiple surgeries that day. So you'll kind of just one-on-one training in your clinicals to get hands-on experience and practical experience. So you're going to be kind of shadowing us all the way up to towards the end of the first semester. You're going to be kind of almost independently running cases where you're going to have a surgical neurophysiologist with you, but they're going to kind of let you run the show. So the whole clinical sequence is about developing your technical skill set to be a surgical neurophysiologist. In addition to that, throughout the semester, we kind of have clinical lab meetings, maybe once a week, once every 2 weeks, to kind of discuss everything that we're seeing in the operating room, to go over some topics that kind of mesh with the things that you're learning in your course. So that's kind of the way it's structured. It kind of evolved from the first semester through the third semester in terms of our expectations and what we like you to know and our goals for you. But again, like Dr. Hale said, our goal is kind of by the end of the program that you were to what we would consider a simple case on our end, we'd be able to kind of set that case up independently and do most of the work for that case with little help from one of the neurophysiologists. And in the past, we've had plenty of students that have achieved that. And a lot of our students have already kind of lined up, work offers before they're graduating from the program. So it's a really, really fascinating, really interesting to see students kind of come in with no OR experience, during the headlights, and then 6 months later, 8 months later, they're kind of running the show. So.
Thank you, Dr. Mack. Yeah, we have some sort of issues. I'm just trying to translate what he said a little bit. Is that one of the unique aspects of our program is that our students start the clinical training very early, and literally start day one. Dr. Mack, Dr. Hale will teach you that you need to prepare for OR training. you need to go through some of the online program, the HIPAA and all that sort of OR tour and so on and so forth. Then very soon you actually getting into the OR to actually see real case and real patient. And he actually demands that the first day you go to OR, you already start to handle some of the activity that involving patient through contact. And you will be under direct supervision to perform that task, and there will be supervisor line of sight to guide you perform the task. Right, so that this is different from some of the other programs in the nation. They may not have the opportunity for students to actually gain hands-on experience. And in addition to that, we also obviously have a didactic course, which show on this picture. We do have a station back to our campus over here. The student can take class in classroom. Obviously, we also have some tools that student can practice, and even a mannequin over there, as you can show, you can see that there's some of the electrode being placed. So basically, you can prepare yourself a little bit before you go to the OR. Just bear in mind, patient service is very, very unique. You must respect patient safety, and we are actually emphasize that in great deal. And everybody who join our program need to show professional manner and also put the patient's interest first. That's all I want to say.
No, thank you, and that's very helpful, Dr. Connect and Dr. Yu. It seems like this would be a very difficult program to learn or to lean heavily on theory. Seems like it's a very applied practice that is, a skill that's honed over a lot of, clinically based courses. So that's great to hear. That's very interesting. And then, Dr. Zaleski, can you speak about the integration of the IONM program and the Doctorate of Audiology?
Sure. What happens is all of our students who come into the Doctor of Audiology program take the Introduction to IONM course to give them some background in it. So one, if they need to be exposed to it in the future, they have some idea what it is about and what's going on. And it also provides the foundation and experience for the students to determine, is this something that I am interested in pursuing further? At that point, during that first semester or sometime after, we do have an application that students have to complete. They have to meet with Dr. Yu, they'll have to meet with myself, and we'll talk about all the program requirements, what it means. And essentially what happens is, as the slide says, it is 12 additional credits or 4 courses, additional courses. So what would happen is you would take the first course in the first semester, and then there will be one in the spring, and then spring and fall, spring the second year, and you'll take one in your third year with that. So you'll be having all the required information that you need. And then what happens is during our third and fourth year, all of our audiology students are on either a third year as a part-time clinical experience, and fourth year as a full-time. You are placed in a setting that focuses on intraoperative neurophysiological monitoring. So that is how it integrates with this. So if anything, the only disadvantage of it is for those 4 semesters, you'll be carrying 15 credits per semester as compared to 12 credits. That's the only difference in the program.
3 credits more fun.
Yep.
So, and I'm sorry, Dr. Zaleski, if you could clarify. So for the students who are enrolled in the Doctorate of Audiology and are also pursuing the certificate in IONM, does it add any time on to the degree, or are you just taking one additional course for an extended period of time?
No additional time. It's just one additional course for 4 semesters. That's all there is. And the courses are, as Dr. Yu had indicated previously, taught with the other interoperative monitoring students. So it's not like this is a separate track or separate entity. You would be integrated with the other students also.
Excellent. And Dr. Hale and Dr. Connect, would you be able to speak to what it's like having to take the extra credits per semester as you know, former, I shouldn't say former, but alums of the program, doing both the Doctorate of Audiology and IONM? What was the workload like having one additional course? Because I would have to assume that the 4 courses you're taking already through the audiology degree are already probably pretty time consuming.
Yeah, it's definitely, you know, time consuming. You know, I got myself to the library. The additional course, it wasn't as you know, as bad as you know, I would think, because it's all I knew. You know, I was really interested in it. I really wanted to do it. And you know, I was passionate about wanting to pursue that as an option. So, you know, I took the extra course, you know, as it was available. And, you know, you know, I don't think it was that constraining that it would, you know, that it was unbearable. Personally, I thought it was a comfortable workload. So
great, thank you. Dr. Connect.
Yeah. So are you guys hearing me okay? Is my speaker coming through okay?
You're kind of ducking in and out. I think we can mostly get the gist though.
So I kind of agree with Tyson. You know, I was really interested in it. I don't think it was that, you know, heavy on me in terms of stressing me out, putting me over the edge. And I think Dr. Zaleski kind of alluded to this here, but there is so much crossover between what we do in intraoperative monitoring and the concepts that we do in audiology in the clinic. Some testing that we do, though it seems very different on the outside, is kind of very similar on the inside. So there's a lot of overlap with the concept. And if any, it kind of, you know, helped me understand some of the audiological things, and then some things that were there really helped me in intraoperative monitoring as well. I think the hardest thing for me for that is that in the audiology program, you start taking those intraoperative monitoring courses, say 2 years before you actually get any clinical experience in the OR. So those concepts can be a little bit abstract at first. Whereas with a certificate program, you're kind of in the OR from day one. So when you're learning that stuff, it's a little bit more congruent to go through the certificate program, because it's really condensed down. So I think that was my biggest challenge, was learning all these techniques and stuff, but having an idea of what they were, but not really being able to do that work for say another year until I got myself in the OR.
Sure. No, that's very helpful. Very helpful. And then, so that gets us into the coursework. Dr. Zaleski, or really any of our faculty here, would you be able to walk us through the coursework expectations and what's some of the course content that students would expect to learn while enrolled in the IONM program?
Maybe I can talk a little bit about here we have lots of courses, and we have made some modification here and there. But the idea is that all of you, if you join our program, you're going to take the intro for IOM, basically highlight some of the, you know, what is IOM, what is the typical knowledge and the information you need, clinical relevance, and so on and so forth. Just give you some good basic idea. Then you notice that some of the course related to maybe the neuroanatomy and the neurophysiology. So those are just prepare you the technique and the understanding of the nerve conduction and how to study the signals that you're looking at, and which actually can readily apply to the patient care. But that's the example you do in the OR, you record those. Now you notice there are some courses related to the surgery, specific surgery, for example, the spine surgery, some of scalpel surgery, cranial surgery. Those are really is to tell you, here you have a surgery, this is surgical procedure, and this is a step that the surgeon is going to help the patient. How can you make a contribution to that? And then for the most important things that we actually have for the certificate program, that we have a clinical practicum. And that clinical course will cover everything, for example, anesthesia, and then the hands-on knowledge of the neurophysics, clinical neurophysics, and also related to the particular surgery application. So that is all I summarized for this slide.
Great, thank you, thank you. And then the job outlook, which I think to no one's surprise, looks pretty good. If for no other reason, there are not a lot of other programs out there. So, so this is a career where there's, very high demand, and there's not a lot of programs offering this. So the people who are graduating with this degree are in a very lucrative position. Anything to add from the group?
I think Dr. Hell can talk a little bit about our students' employment.
So. Correct. Just quick. If we get time, we have one of the students in the Au.D program who actually started off as IOM, Mike Delonce. He'd be able. Do you want him to say a few words and about the program, his experience?
Most certainly, yes. So, Michael, whenever you're ready, you can turn your camera on. You should be able to now and speak, provide testimony to your experience in the program. Oh. Hi, Mike. Can you hear? I think you're muted, buddy.
I was muted. Yeah, so my name is Mike Delanoche. I am one of the graduates from the IONM program back in 2018. I apologize for being late. I actually came from class. As Dr. Zaleski said, I'm currently one of the students in the Bloomsburg Audiology program. In terms of job outlook, I mean, I pretty much was already secured in a position by the time I got out of the certificate program. So there's a lot of opportunities that you're able to do that. And I know just from experience, I'm approaching my 5th year in the field, just people that message me on LinkedIn, people that message me through different email avenues and things like that. Just by having that experience, there's a lot of opportunity available as long as you get your training, you get your certificate, which I'm sure the CNM was probably talked about already. I'm not sure if it was or not, but yeah, very good job opportunities from all over the country. A lot of places need technologists. So.
Yes, that's great. Great. Thank you. Thank you. Aaron and Tyson, what was your experience like after you finished the program? I believe you're both working for the same hospital network, but what was the job search like for you?
I'll go ahead. Okay. So I think Dr. Zaleski kind of alluded to this earlier, that, as the audiology program, we kind of do our 3rd-year internships, 4th-year externships with these IONM placement sites. And I was actually hired by that company during my 3rd year of the audiology program. They started paying me. They offered me a formal kind of position for my residency year, but that was basically a full job offer. So I was hired before I graduated. And then I was with that company for a little while, and I got a call from Dr. Hale. Said they were looking for another audiologist up at Geisinger, so he kind of picked me to come up there. So that's how I made my way up here.
That's great. So now, Aaron, you mentioned the residency. So what is the residency like, and when does that come into the picture then for a student who's pursuing IONM?
So that's the audio program. That's the clinical fellowship year for audiology. So that's specific to the Au.D program.
Gotcha.
That's the 4th year of that program. So a little bit different than just a certificate program.
Excellent.
The first certificate program, just like Michael mentioned, he also got the offer before he graduated. So with less than 1 year with us, he already got an offer. So it's the job opportunities should be plenty.
Now, would you all say that your career options, your job outlook is enhanced by having the IONM certificate in addition to the doctorate of audiology?
So they all mute that. Let me talk about. That's why Tyson become a manager of
Right.
his organization because he has the advanced degree. That's why Aaron become a leading technologist in operating his hospital because he has this profound background that required to provide service at the highest level.
Excellent, excellent, great, thank you. So then the application and admission process. In the application and admission, Dr. Yu, would you be able to walk people through kind of what you're looking for, who would make a good applicant? And honestly, there's probably students who are watching or going to be watching the recording who are wondering, how do I know if I'm a good fit for this? What are some of the checkpoints where if I like this subject, I might like this too? Would you be able to walk us through that?
Sure, but actually I want to defer to Dr. Hell because he is the one actually can make really meaningful input here.
Okay.
Tyson, can you unmute yourself about the application? What kind of applicants you want?
So we generally like to, well, first of all, we look for a bachelor's degree prerequisite, which I believe everybody that would be watching this, has a bachelor's degree, preferably in a science related, health science related field. As we have listed here, courses in health science or exercise science, psychology, and communication science are all definitely, looked at in higher regard. And then the last bullet point here, applicants who do not have the expected foundational coursework may still be accepted provisionally pending completion of a program prerequisite study incorporating 3 of the aforementioned areas of study. Now we also look at a case-by-case basis and related coursework as well. Chin, if you wanted to, Dr. Yu, if
can you talk a little bit about the interview process, what we're looking for? And that's why I defer this to you. The
right,
interview process.
Yeah. And in addition to the prerequisites with the application and things like that, we like to have an interview with the candidates. A few of the things that we look for are, one being a little bit more flexibility with your outlook for your in your career, because IONM isn't a 9-to-5 job. It's not a stable job in regard to hours. It's not like you come in and leave at the same time every day. We're almost at the mercy of the operating room. So you need to be a little bit flexible. Now there are some institutions that are have a little more stable hours than others, and I believe Dr. Zaleski or Dr. Yu commented as well, but about the working with like an outside company. I would say outside companies probably employ 70 to 80% of the workforce in regard to surgical neurophysiologists. When you're working with these outside companies, they tend to have contracts with many different hospitals. So Geisinger is a little bit more unique, and we're probably into that 20%, that employ an in-house program. And so, but when you work with one of the outside companies, you might travel a little bit more, but you might also have go to report to one major hospital with that outside company. But the general trend is you might have a little bit more volatility. In addition, there's these companies are present in almost all states in the U.S. So if you're a little bit more flexible with your travel and maybe where you want to end up, we try to feel that out, because if you want to maybe like live in one geographical location, that it might be a little bit more difficult to find a job if there's not a bigger hospital that would support the kind of surgeries that we monitor. So generally in more rural areas, however, again, Geisinger might be an exception. We're kind of in Danville anyway, we're a little bit more rural. Sorry, I meant to say urban areas is where the bigger hospitals are that probably have more jobs, but Geisinger would be the exception, being in a more rural area. So that's kind of one of the things we like to engage in an interview and figure out The other is, you know, your personable skills, being able to communicate effectively or handle under pressure. Sometimes the operating room environment can be a little bit stressful, especially if there's any kind of major changes or any kind of complications, and just being able to
Just a little bit.
just a little bit sometimes, just being able to handle yourself under pressure, and you know, kind of be able to communicate with a variety of personalities is definitely helpful. And that's not to say, you know, that somebody that's more timid or shy can't do something like this. Now, we've seen the full spectrum of personalities, you know, in the operating room, and then we're doing IONM. But generally it's nice to be, if you can kind of communicate a little bit more effectively, and you know, be vocal when you're reporting a change to a surgeon and things like that. So those are the types of things we like to talk about and engage potential candidates.
And would you be able to speak to then, so for a student who's already admitted to the doctorate of audiology, what is their admission process like? Or is it basically the same as what we're seeing here listed on the screen? Or is there some different standards then because they've already been admitted to the AUD?
I can speak to that. No, there is no different standards. The only difference is they do the application. They speak with Dr. Yu. He gives them more information on what to expect. I talk with them from the audiology, so they understand what the expectations are from the audiology perspective. But there are no additional courseworks they have to take, because the students that we are admitting do have backgrounds in sciences and the psychology and those in the math, because those are all foundational courses or important backgrounds to have for audiologists. So there is no difference. So it's not like, oh, I want to go this, oh, now you have to take a couple courses here. It doesn't work like that. So if they're admitted, they submit the application. After they speak with Dr. Yu, speak with myself at this time, and move them on through if they're interested. So as long as they realize what the expectations are and what's going on, they don't have any problems getting through it.
Yeah, absolutely. I just add up, because students who admit to our AUD program already commit to provide patient service. They have many years of the training with us, so they are actually naturally able to transition into the intraoperative neuromonitoring. It is a certificate students that some of you may be here just to consider some other career with the ION. So we want to make sure that you have this trait of to care about the patient, can be an effective communicator and dedicated for the profession, and find, you know, to help the patient and make a difference that rewarding. That is what we're looking for.
Great. All right, great. Thank you. And then that brings us to our Q&A. And I don't know if there are any questions here from anybody in the group. If you do have questions, now is the ideal time to ask them of our faculty. But I know one of the questions that I personally have gotten about the program is, if you are enrolled in the audiology program and IONM, when would you start to take the IONM courses? Is that first year? Is that third year? At what point, like, where's the on-ramp to the IONM cert courses?
As we said, every student coming into the program takes the introduction, and then at that point, they make the decision whether or not they're interested in the IOM program to get them in for the spring. So they would go right from the fall into the spring to the IOM program. Just a quick question, Tom, I was just thinking, perhaps wonder if Mike could give some insight into the whole application process, and that, since he went through both processes. So if he wants to give some personal insight into the process.
I mean, personally, based on my experience, they're both very similar processes. The only differences between my coursework applying for the AUD And the IONM program was the fact that I had the IONM coursework alongside of it. So it was just a little bit more reinforcement that I could handle that kind of an academic setting. Otherwise, I mean, very, very similar process between both of them. I can't really find any hard differences outside of I didn't interview for the AUD specifically, but things may have changed from 2018, 2017 to the past couple of years. But other than that, honestly, no significant difference on my end from the application process.
So, Mike, if I understand this correctly, did you start in the IONM program first and then decide to also take on the AUD as well?
Correct. So
Okay.
I did the IONM program in 2017 to 2018, worked for about 3 years, and then I started the AUD in 2021.
Gotcha. Okay, great. Got a little bit and decided you wanted more.
Yeah, so we have a question here. What is
Yes.
the average percentage of AUD students who you already enrolled in the program? I can talk a little bit, maybe Dr. Z can give us some more idea here. Basically, they vary quite a bit, and but because in the past we actually have more courses required. Have more courses required to get the certificate, as Tyson and Aaron, Dr. Hell and Dr. Connect mentioned, that's experiencing some additional works. And recently, we actually streamlined the courses and reduced the number of the additional courses to 4 courses only. And this actually makes the thing much, much easier and make a lot of sense. And because once you had take this additional 4 courses, you will be qualified to have the opportunity in your 3rd year to go to the organization that you choose, our contractor, to learn about IOM in addition to your AUD training. So basically, you can dedicate a few semesters for your IOM training, and then dedicate a few semesters for your AUD training, and then you make a decision afterwards. So just basically give the student more opportunities. And currently, we have quite a few students interested in this process within our in-house program. Dr. Z, I want to talk.
I was going to say I agree with you 100%, Dr. Yu. It varies. We've ranged from having 5, 6, 7, 8 students from a cohort to sometimes no IOD students. So it varies. I think it's very similar to what, I can't remember if it was, I think both Dr. Hale and Dr. Connect had indicated that if it's something that you're truly interested in and you truly wanted to do, it's really not anything that much more time consuming or going to take up that much more time, and it just preferences, so if you think this is something you might like from in the AUD program, get into, see how you do with the intro to IOM course and see if you like it, and if it is, you can pursue through it. We've actually had students get started in it and get 2 or 3 courses into it and say, I'm not sure, and it happens, but so there is that option also. So it's not like, oh, I decided I got to go through this. If you decide, hey, this is something I thought it was, it's not what I thought, that's fine also.
Yeah, so that's why the AUD IOM sort of track is a self-selection. So basically, we provide you with this opportunity. You can even take a few courses, but you decide, my personality is not really into this, the OR dynamic environments, then you don't have to do it. But for the certificate students, we actually have to make sure that the students demonstrate the reasonable communication skills and so on before we admit you in.
And I see we have another question in the Q&A from Paula, which is a very good question. How many students generally are admitted to the IONM program per year?
So maybe I can answer this question. And currently, for the certificate students, which is 1-year program, because the Geisinger capacity, we can only admit 8 students. Is that right? Right. So I think this depends on our collaborators over there. And for AUD students, that is a self-selection. We don't have any limits over there, but we want to have a balanced students come out to practice the audiology service, as well as some of the students may want to get involved in the IOM.
So it's 8 for the standalone certificate, and then basically as many AUD students are interested. Okay.
Yeah, they can always make a decision whether they continue this or not at a later time. It's not determined at this stage.
Okay, great. And I know, Dr. Zaleski, in one of your previous presentations, you had mentioned IONM, and I hope I'm remembering this correctly, that there is the potential for this career to be done remotely. Does that sound right? I remember you saying something about doing this job in your slippers.
Oh, yeah. Depending on what happens, if you have the AUD with the IOM, as you know, Dr. Hale and Dr. Connect, it opens up different opportunities for you where you can be a supervisor. And there are some states where you can do some remote supervising. So you can be home remote supervising. I'm not sure if Dr. Yu could add more information on that. So yeah. It's a nice gig. Like I said, you can sit at home in your bunny slippers, drinking your coffee and monitoring a whole bunch of other cases. So I'll let Dr. Yu answer.
Well, that's just like a really rosy picture. It is possible, and we do have students get to this far, but the process by which you need to really work your way to there. So you need to gain hands-on experience. You need to stay in OR for a few years and gain all the experiences and the knowledge. And then as AUDs, you actually have, because of the ASHA, which is the organization for AUD in general, they have this board exam, and then our student must sit for the exam, write that exam, pass it, and also enroll in this ASHA sort of credentials. Then once you have go through that with a lot of experience that on your belt, then you can have an opportunity to work as somebody who supervise the technologists working in the OR in the capacity of that they remote send you the recordings live where you are on your slipper pajama, and you look at that, you make a professional judgment and suggestions to the technologists on the other end, also the surgeons on the other end, to tell them that this probably is a meaningful thing, that I suggest you perform this kind of procedure and that kind of procedure to correct it. So basically that's the practice of the IOMs always, in addition to a technologist in the OR perform the procedure, you always have somebody remotely look at your data and offer the professional components. This typically is done by the medical doctors, neurologists, and there's some other type of doctors can do so. But there's just like Dr. Z mentioned, there are many states, I think 20 of some states, that allow the audiologists to assume this capacity.
Is it safe to assume, Dr. Hale and Dr. Connect, that the slippers are not appropriate attire for in the OR? Obviously, can we merge the ideas of comfortable shoe wear and also operating or in the operating room?
I mean, I have the Superman slippers. I don't have the bunny slippers.
Oh, okay. All right. So Superman's, yes. Bunny's where we draw the line. That's that's not business.
Although my daughters, they do have some bunny slippers around the house. So I have to be careful.
Yeah, don't say that too loud. No, that's great. Dr. Yu, the other question I had is, so there was a photo of you earlier in the presentation of you teaching a class, I believe on the Bloomsburg campus. there's an IONM lab. Can you talk about what students might be doing in the IONM lab? What type of content would they, would be delivered in that setting?
Well, the lab, in the lab we have several different types of the equipment, and we have a mannequin over here. We have a gurney and quite a few different tools over here allow students to practice their techniques. And in addition, I also serve as a home base for the IONM certificate students, because if you go through this 1-year program, you will need some place where you can study and serve as your home base, and the student can, if you want, they can work over here, practice their skills, and doing many different things, assignments, etc., etc. We do have several really standout equipment allow you to do enjoy the full spectrum training. That's really what we stand out in that regard, because all no other program in the nation has the luxuries to enjoy the spectrum of the tools we have. We have everything that possibly you can think. So that is our home base. Provide this kind of environment to have students come in and enjoy their study.
Great, thank you. And then, so my final question then for the night is for Michael. Michael, can you walk us through kind of the student experience of being enrolled in both the IONM program and the Doctor of Audiology? I mean, walk us through, like, what's a day in the life look like for students who are considering both programs or either? What do you eat for breakfast? What do you do in between classes? What's your semester look like? What are you binging on Netflix?
So since I did both separately, it's probably a unique experience compared to what these other students are going to be going through, whether they choose to do the AUD and have the IONM concentration or do just the IONM program. So I guess I can kind of go into a day in the life of both. So for the 1-year certificate program for students who are only doing that 1 year, you have 12 credits, 3 of which would be your clinical coursework. So pretty much 3 3-hour lectures in a week. That covers all your coursework.
Okay.
3 total lectures, I should say, not 3 for each class. So 3 hours a week per class. And with that, largely instructed by Dr. Yu. Sometimes you'd have Dr. Hale or Dr. Connect involved with those lectures, and they were mostly at night. Sometimes you would have like a later afternoon course. Then 1 day a week, maybe some more, you would go into the Geisinger health system areas and do your cases and get at least a case in per week. Sometimes that takes up a small portion of your day. Sometimes it takes a large portion. Like everyone said earlier, it's not a 9 to 5.
Michael, when you say a case, and Dr. Hale, I heard you mention this earlier as well. When you say a case, what does that mean?
Just a patient going in for that surgery. So for example, if it was like Joe X going in for a lumbar fusion, that specific surgery, what they're going through, that is a case. So each case could be a little bit different between back surgeries, brain surgery, or cranial surgeries, other procedures like that. So each one is kind of its own case.
Thank you.
But, so ideally, we have students come in early morning before the case, so-called surgical case start, and they're going to shadow the supervisor to observe, talk to the patient, and set up the machine and getting ready to have the patient get into the OR and set up all the recording devices and make sure all the signals is running. And then when surgeons start surgery, they still being there to observe any change of the surgery. Once the surgery has been successfully finished, then they actually help the supervisor to remove the electrode and move the equipment back and generate a report. It's a whole process from start to the end. That depends on, there might be 2-hour surgery, there might be, as mentioned, 24-hour surgery, but we don't keep students in the OR for 24 hours, but just so that your hour can vary quite a bit. And we like students to have a decent amount of hour, because the longer time you stay in OR, the better you're going to be in terms of your knowledge and skills. You need to feel about it. You need to feel the environment, feel how people doing things, and how people interact with each other. What's the manners over there? How to navigate all the system. The more hours you can stay, the better outcome.
Great. Thank you. Thank you. So Michael, you get through your case. What are you like, I guess, what's the quantity of time you're spending studying, working on projects? Are you, is there a lot of like group work? Is there any group work at all? Can you walk us through the rest of your day or week?
I definitely noticed. So I'm more of a bulk in one sitting studier than I am like chip away at it during the week. So take this as you will. I would say like between both sets of programs, in my experience at least, I've probably put in a couple hours a week of studying, kind of just mainly go over things on a weekly basis, stay fresh, especially with Dr. Zaleski's coursework. He likes to challenge us every week with things. So he likes to keep us fresh. So it's definitely something you need to do. Otherwise, I mean, you definitely have some more time with the IONM program as opposed to doing selectively the AUD. And that's just solely because more at home work, more group projects, more research work relating to what you're involved with, especially within the AUD. And I mean, it is a doctorate degree versus a certificate program, but the IONM program, in terms of outside coursework and things, it's its own upkeep as well. You can fall behind if you don't keep up with it, but I would say a few hours a week definitely needs to be devoted to just putting in that work.
Okay. And Michael, are you a residential student? Meaning like, are you attending courses in person or are you remote?
In person.
You're in person. Okay. Excellent. Excellent. Okay. And lastly, you probably want to answer this very carefully, but your favorite class so far and why? Now, keep in mind, this is a minefield. I really put you in a tough spot here because I'm assuming some of the gentlemen here are teaching your classes.
Oh, they are. I mean, it would I kind of have to see how it goes the next few weeks, because personally, my biggest interest and part of why I came into the AUD was to learn more about what's called ABR, which is which stands for auditory brainstem response. It's one of the tools, modalities that we would use in intraoperative monitoring, as well as audiologists in the clinical setting. And I'm currently in a more in-depth course with that, taught by Dr. Zaleski. But since we're only in week 4 right now, I can't decide if it's my favorite as of yet. But I would say if I had to choose, that's probably going to be my favorite so far.
Okay. Michael, that was beautifully answered. You walked a very tight line in diplomatically, you know, getting across your answer without really offending anybody. So, well, I mean, you might have a future in politics if the whole audiology and IONM thing doesn't work. So well done, my friend.
I'm really hoping this works because I don't want to go into politics whatsoever, but I appreciate it.
Yeah, no problem.
I do have to say, Michael, thank you, but that doesn't mean you get any bonus points for that. So
did not expect to.
Is worth a shot though. So that is it. And let me see, I don't see any additional questions. So thank you everybody for joining us. I know just about the whole crew stuck with us for the whole night. So really appreciate that. I laughably said that this might run 30 or 40 minutes. So again, thank you so much. We most certainly look forward to hearing from everyone in the future, whether you're watching live or watching the recording. We are happy to help in any way possible. We work for you. It's basically how this works. So if you have any questions, if there's anything we can do to help you along the way, please do not hesitate to contact us. And I hope everybody has a great night.
Thank you.
See you, everybody.
Bye.